I am Monica Chacha, Nurse Navigator in the Stem Cell Transplant and Cellular Immunotherapy program here at MedStar Georgetown. So as the Nurse Navigator, I am in charge of the intake process for any new patients to our program. And so what that looks like is I'll reach out to the patient and gather some initial information. Usually that's just a telephone call. I'll ask them about their insurance so that we can make sure that they have benefits in network for our program here and that they're able to get either CAR-T or transplant, whatever they were referred to. I'll also get some initial records about them, so I'll reach out to the referring provider to get some information about what treatments they've had, where they were diagnosed, all of the information so that we're able to see the full history and story about the patient. After that, I'll actually send out a new patient packet to the patient so that they're able to really fill us in on their story. And this is going to include some social history, some history about their health, if they have any other conditions, any medications that they're on, so that once they come into our program, our providers have a full picture of the patient. And then we can actually work on getting any biopsy slides from outside facilities to be evaluated here by our pathologist, and then eventually we'll work to schedule the patient for an initial consult. When a patient comes to MedStar Georgetown for treatment, they should expect cura personalis, and that means care of the whole person. To me, that means the patient is not only seeing one provider, but they're really seeing a whole team who is looking out for their benefit. And that includes people like financial analysts, that includes people like social workers, and nurses like me who really want the best for the patient. So as a nurse navigator, I have almost 12 years experience working as an oncology nurse. I am also an oncology certified nurse. I've worked both inpatient and outpatient, and I have a really good working knowledge not only of cancer care, diagnosis, and treatment modalities, but also just communicating with and supporting patients through their cancer journey. One of the things I enjoy most about my job is being a part of this clinical care team. In all my experience as an oncology nurse, I feel like this is the most cohesive team that I've been a part of. And I think it's really impactful and special for patients too, because they not only have the nurse and the physician, but they have an entire group of people who are really focused on their care. And that is from everybody from the financial analyst, the medical assistant, the nurse, the physician, the nurse practitioner, pharmacists are involved, and also social work, and everybody is looking for the care of that one patient. So I find working as a nurse navigator to be very rewarding, and one of the things I enjoy the most is really being able to put people at ease. So maybe we have a patient who is newly diagnosed or newly referred to our program, and I really enjoy being able to walk alongside them and eventually handing them off to our expert care team, which looks like the physician, our clinical nurse coordinator, and the rest of the team. Here in our stem cell transplant program, we are really lucky to have an amazing team of financial analysts. And so they are able to look at a person's insurance, check their benefits to make sure that a patient is eligible to come here and make sure that they have benefits for maybe transplant or CAR-T therapy, whatever they're coming for. We work really hard to communicate and work very closely with any referring providers. So really we like to be seen just as an extension of that team. You got the treatment that you needed there, and we are really the next step in your care. And so we're very good about making sure that they know the plan and that we know what they're doing as well.